Hello everyone. Today we will address a very common and a very interesting question which we keep getting through emails and WhatsApp. Sir, I have a hernia. I am too scared of surgery. I have heard somewhere that using a hernia belt can prevent a surgery. I need not get a surgery done. Is it true? How useful is this hernia belt? So let us see this topic today. Hernia belt or a hernia truss. So this is basically, once you understand what a hernia is, you will understand what a truss is and how a hernia is treated. A hernia is basically an intestine coming out through a hole in the abdominal wall. So it protrudes out through a hole, and whenever the patient coughs or strains, more and more intestines bulge out. A hernia truss or a belt is a strap which is worn around the groin, which has got a thick padded or even a metal end on the front. So the basic mechanism by which a truss works is, when the hernia is pushed inside, this belt is tightly worn and the thick metal area or the padded area presses as a stopper on the hole of the hernial defect and thereby keeps the hernia inside and prevents the hernia from popping out whenever the patient coughs or strains. So this is how the truss was basically designed. This used to be very popular at one time, but as years progressed, we realized that this may not be as useful as they were thought to be. Even though the mechanism looks very simple, it actually can cause more trouble than good. Why? Because before anyone wears a tight belt, one has to be extremely careful that the hernia, the intestine which has come out in the hernia, has to go back completely into the abdomen, and then the truss has to be applied. If the hernia does not reduce back and the truss is applied tightly over it, what can happen? The intestine which is partially out can get crushed between the truss and the abdominal muscles, and that can cause damage to the intestine. Secondly, if you continue to wear this tight compression on the groin region for a longer time, like we all know, if something is pressing on the skin or the muscle, it does not allow good blood supply to reach that area. Because of constant pressure, the muscles slowly start getting thinned out, and thereby already a hernia is formed because of weak muscles. Over and above that, the truss has thinned out the muscle further and your muscles become more weak and the hernia rather increases in size instead of decreasing. So what is the use of this truss? Nowadays, we hardly ever, or we do not advise patients with hernia to use a truss, because surgery is very effective at curing hernia. If at all one wants to use a truss, there are certain things one has to keep in mind. A truss is a temporary solution to a hernia. Suppose for some reason somebody cannot undergo a surgery immediately and the hernia is repeatedly causing pain or trouble, they can use a truss to keep the hernia inside till the time they undergo a surgery. Second, they should understand the correct way of applying a truss, meaning before applying the truss, generally the patient is asked to lie down, so that in the lying down position the hernia returns back into the abdominal cavity, and then the truss is worn tight and the patient gets up. So these things one should always bear in mind when thinking of using a truss. A truss is not an alternative to surgery. The only effective treatment for hernia is a surgical repair. A truss is only a temporary bridge whenever surgery is not possible immediately. At the same time, there is something called a hernia belt which we advise to patients to use. When this is usually advised following a hernia operation. After a patient undergoes a hernia operation, especially a hernia in the abdominal wall, like a ventral hernia or an interstitial hernia, or any patient who has undergone major abdominal surgery. For these patients, when they go home, we advise a different type of belt called an abdominal binder. This is a very wide or broad elastic belt which is worn around the abdomen, and this gives a good support to the tummy when the patient is recovering from a major operation. So initially, when the stitches are raw, when the scar is just getting strengthened, the patient needs some support from pain, and that is the time these binders are very useful. So a hernia truss or a hernia belt is not useful before operation, but an abdominal binder, which is a different type of belt, is extremely useful for patients who are recovering from a major abdominal surgery or a major ventral hernia surgery.